The most common symptom of pneumonia is a cough that produces sputum. Other common symptoms include chest pain, chills, fever, and shortness of breath. These symptoms may vary, however, depending on how extensive the disease is and which organism is causing it. A doctor or nurse checks for pneumonia by listening to the chest with a stethoscope. Pneumonia usually produces distinctive sounds. These abnormal sounds are caused by narrowing or airways or filling of the normal air-filled parts of the lungs with inflammatory cells and fluid, a process called consolidation. In most cases, the diagnosis of pneumonia is confirmed with a chest X-ray, but most bacterial pneumonia, the involved tissue of the lung appears on the X-ray as a dense white patch because the X-ray beam does not get thoroughly compared with nearly healthy lung tissue that appears black because of X-rays get through easily, exposing the filmed viral pneumonias typically produce faint, widely scattered white streaks or patches. Some pneumonia can lead to a lung abscess, which appears on the X-ray as a space filled with fluid or pus. There may be changes at the top of the lung suggesting tuberculosis. Thus, the X-ray may, but not always, help a doctor determine which organism is causing the disease. Doctors culture sputum and blood specimens in an attempt to identify the organism causing pneumonia. However, despite these tests, the precise organism cannot be identified in up to half of people who have pneumonia. When it is necessary to identify the organism, such as when the person is severely ill and is not responding well to the therapy, doctors can try to obtain better specimens by inserting a bronchoscope into the airways, bronchoscopy. Several types of pneumonia can be prevented with the use of vaccine. Vaccines are available to protect against pneumonia or pneumococcal pneumonia. Pneumonia caused by the bacterium Haemophilus influenzae and pneumonia caused by the influenza virus, which also often leads to a secondary bacterial pneumonia. Deep breathing exercises and therapy to clear secretions help prevent pneumonia in people at high risk, such as those who have had chest or abdominal surgery and those who are debilitated. People with pneumonia also need to clear secretions and benefit them from deep breathing exercises and therapy, as well as people with pneumonia who are short of breath or their blood is low in oxygen. Supplemental oxygen is provided. Although rest is an important part of treatment, moving often and getting out of bed and into a chair are encouraged. Usually, antibiotics are started whenever bacterial pneumonia is suspected, including obstructive pneumonia, even before the bacteria is identified. The prompt use of antibiotics likely reduces the severity of pneumonia and the chance of developing complications, some of which can lead to death. When choosing an antibiotic, doctors consider which bacteria is likely to be the cause. The doctor can change the choice of antibacteria later after the bacteria has been identified and the susceptibility to various antibiotics known as its susceptibility to various antibiotics. Often people who have pneumonia but are not very sick can take oral antibiotics and remain at home. Older people and those who are short of breath or have pre-existing heart or lung disease are generally hospitalized and given intravenous antibiotics to start. Those antibiotics are usually switched to oral ones after a few days. These people also need supplemental oxygen, intravenous fluids, and mechanical respiratory support. Antibiotics are not useful or helpful for viral pneumonia. However, antibiotics are given for viral pneumonia that are likely to be followed by bacterial infections, such as those caused by respiratory syncytial virus infections in infants, and sometimes those caused by the influenza virus, at least in some people who are very susceptible to pneumonia. Streptococcus is the most common bacterial cause of community-acquired pneumonia. Other causes of community-acquired pneumonia include Haemophilus influenzae, Legionella, Mycoplasma, Chlamydia, and viruses. Staphylococcus may rarely cause community-acquired pneumonia, but this organism is more than a cause of hospital-acquired pneumonia. Community-acquired pneumonia occurs most commonly in very young and very old people. Pneumococcal pneumonia is caused by Streptococcus pneumoniae or pneumococcus. It usually starts after an upper respiratory tract viral infection. A cold or influenza damages the defenses of the airways enough to allow bacteria to infect the area. Shaking and chills are followed by a fever, a cough that produces sputum, shortness of breath, and chest pain on the side of the affected lung when breathing. Nausea, sometimes fatigue, and muscle aches are also common. The sputum is often rust-colored from blood.